I call Lord Blunkett to ask the first oral question.
I beg to ask the question standing in my name on the order paper.
The Minister, Lord Bethell.
My Lord, since May, individuals in England who have had 2 doses of an approved COVID-19 vaccine can demonstrate their vaccine status for international travel. The services can be accessed through digital and non-digital routes via the NHS app, the NHS website, or by calling 111 to request a letter. The devolved administrations are making available similar letters for use in travelling overseas. Over 63,000 people have requested a letter since the service was launched.
Okay.
I'm very grateful to the Minister for his positive answer. I wonder if you could tell the House exactly how long it takes to get a print letter as opposed to downloading the app, and how this will relate to the new ETA, the travel authorisation, which hopefully will coincide with lifting restrictions on British travellers here and abroad.
Well, my Lords, the number of people who have actually received their letters is so far 57,000. I'm not aware of any delays, and those who wish to can use a pharmacy to have their letters delivered. So I think it is encouraging news that we have gone to considerable lengths to meet the suggestions of charities whom we engaged with on the matter of the letters. They are available in different languages and in Braille.
Harris of Haringey.
Well, so I refer to my interest in the register. It does sound as though what you really need is a secure card that proves your identity and has important information uploaded to it, like your vaccination status. Something my noble friend was introducing only to have it scrapped by an incoming Conservative government. 10 wasted years. But if there is to be a vaccination app or some other certification, can we be assured that it will not contain data that purports to show that holders are safe to travel because they have had a negative test under the absurd test and trace scheme? The BMJ has reported that the level of false negatives is of the order of 30%. Such negative tests have no probative value, despite the government, according to the Public Accounts Committee, wasting £37 billion on them.
My Lords, that isn't our approach. Our approach is to try to use whatever technologies work in order to open up our borders. The idea that 30% of tests aren't correct is an unhelpful suggestion by the noble Lord, and we will be using testing in the validation app.
Browning.
My Lords, I declare my interest as a Vice President of the National Autistic Society, and my noble friend will be only too well aware that many people on the autism spectrum are very IT savvy. But can he help with those people who would actually find it quite a challenge to phone 111? Is there any way the government can communicate with the autism community, perhaps through the charitable sector and others, to make alternative arrangements other than just a phone call?
Well, my Lords, we have engaged with the sector considerably on exactly these kinds of matters. GPs and pharmacies are also briefed to help those with difficulties to get this material. We are also conscious that some with autism may struggle to take a test to find the process of swabbing intimidating. So we are also looking into ways in which we can find workarounds for that.
Scriven.
My Lords, regardless if you hold a paper or digital record, personal health and personal data will be held on a central database. Can the Minister therefore inform us which government departments and private sector organisations will have access to the data on the central database?
Well, my Lords, vaccine data is held in the vaccine database and also in the patient's record. The principle that we abide by is that the data is owned by the patient.
Lord Flight.
Lords, Lord Bethell has really answered this question, but can I simply add what my thoughts were, that it surely would be possible that vaccination units could all have supplies of certificates that they can issue to people when they come get their first or second vaccination.
Well, my noble friend alludes to having pre-printed certificates. In fact, each vaccine certificate has a tailored QR code, a two-dimensional QR code, which is designed for each person. Therefore, it is necessary to print the certificate for the person because it has their specific details on it.
The Earl of Cloncarty.
My Lords, I am a little confused by what the Minister is saying. Is he saying that we're not going to get a proper COVID passport, as the EU will be offering from July the 1st and Ireland from July the 19th in both digital and physical options? I wonder if he could answer that question in detail.
Yeah. Well, my Lords, I apologise for not being more clear. Can I be absolutely crystal clear? Today, you can have a digital certificate on your iPhone, you can have a digital certificate that's printed out from your computer, or you can call a number and have a paper certificate sent to you in the post immediately. All of those options are live today.
Anna Thornton.
Thank you. Disability campaigners are deeply concerned about the integration of health data into cultural participation, and the government's plans to set up the vaccine passport scheme could undermine the rights of disabled workers and audiences who cannot have a vaccine because of a health condition. So what steps are the government taking to ensure that any scheme that is introduced obeys the 7 key inclusive principles, including complying with the Equality Act and making reasonable adjustments to ensure disabled people do not face discrimination?
Well, my Lords, I am very alive to the concerns of the disabled. We have to balance the need to limit the spread of this virus, to save lives, but we have to do that in a way that is fair and just to all people. And we are very much engaged with disability and other charities to ensure that that works. Noble Baroness is right that there will be some people for whom the vaccine doesn't work, but who could yet catch the disease. We need to make provisions for those people, and we're working on that.
My Lords, I'm concerned for the significant numbers of people with existing mental health problems who often don't feel comfortable with smartphone devices, as the information overload it can provide can exacerbate their feelings of stress and anxiety. I'm pleased to hear the Minister say that there will be other channels available to these people, but could the Minister say what arrangements they are putting in place to ensure that such people are aware that there are channels other than smartphones that they will be able to use?
Well, my Lord, all of the promotion for the vaccine certificate through travel agents and through GPs makes very substantial reference to the availability of paper letters and the channel of being able to call 119 to receive them. I completely sympathise with those who don't want to use their mobile phone for everything, and some will prefer a letter in the pocket rather than on their phone.
Annis Rawlings.
My Lords, I'd like to thank the Minister for his clarity, but proof of vaccination is irrelevant if we are prohibited from travelling. The Prime Minister is rumoured to have discussed travel to and from the United States with President Biden at the G7, but what are the predictions regarding UK citizens travelling to Europe, apart from Albania, which it seems to be okay?
I don't know about Albania specifically, but the freedom to travel in Europe is, of course, in part defined by Europeans themselves, and we are in conversation with all European countries at the moment as to how the vaccine certificate scheme can be aligned with theirs. Indications from Europe are that they are interested in having a 2-vaccination programme for entry as well, but we are trying to understand that more thoroughly.
Ernest Hoy.
My Lords, I welcome the choice that people are being given as to how to prove that they've been vaccinated. But as the government furthers the digital economy, will the government make it clear that no one will be left behind, in the sense that those who do not wish to go online and don't want to be able to do everything communication in that way will never be stopped from being able to use the telephone or by letter any government service?
Yes, I completely endorse that sentiment. And can I pay tribute to 111 and 119, two facilities that have been used to an incredible extent during this pandemic. A lot of people would much prefer to hear someone at the end of a telephone, to have that reassurance and that personal touch. That is why we've substantially invested in both of those resources and will continue to do so.
Vesey of Didcot.
My Lords, I love the NHS app, and in fact I used it yesterday to gain entry to Wembley Stadium to watch England's great victory over Croatia. Will the Minister first of all consider making sure additional vaccinations can be loaded onto it, such as the flu vaccination, and also start a major advertising campaign to increase the numbers from 6 million to who knows what?
Well, my Lords, I pay tribute to the England football team, who did extremely well, and I'm very glad that my noble friend was able to attend. And he is entirely right. This is an incredibly valuable resource. We have a very strong preventative agenda in our healthcare strategy. The vaccine has demonstrated how we can use modern medical technology to prevent the spread of disease. And it is by using thoughtful technology like this app that we can really popularise and make useful a vaccine approach that could reach out to other diseases.